Good morning, one and all. I am Arpita from the IGCP group, the moderator for today's session. The topic that we are going to cover today is Symphony Under Knife, AI and Human Touch. And yes, to bring this very interesting topic, we have with us none other than Professor Dr. J.A. Jayalal, sir, who is an expert in this field. It's an honor for me, sir, to welcome you to our platform and to introduce you to everyone. The sir is known to everyone still as bit of introduction. He has done MS, DLS, FIA, GES, FMAS, FICS, FACS from USA, MBA, FII, OPM, DLS from Germany, PhD in surgery, FRCS from UK. He is the president of Commonwealth Medical Association UK, PG teacher, professor, and HOD of surgery at the Kanyakumari Medical College, which is at Tamil Nadu. So, with this very brief introduction of Sir, now I would request him to please take over the stage. Over to you, Sir.
Thank you. Thank you for the invitation to be with you at this moment. I take privilege in congratulating the IJCP for the human service you are doing in disseminating the medical knowledge to the common man and the medical fraternity. I'm extremely happy to be once again be part of this Med Talks. Today, I'm going to talk to you, or we're going to discuss on the one of the newly emerging technology in the medical field, almost in all field, and especially in the medical field, is in artificial intelligence, and especially its role in the surgery. And we all are sure there is two things in the surgery. One is a human touch, now the AI, and how these two are going to merge, and is they are going to be a problem. That is what we are going to discuss now for another 45 to 50 minutes. We all know the Mother Teresa's statement, which is one of the very famous quote from her that people said, the people have forgotten what the human touch is, what it is to be smile, for somebody to smile at them, somebody to recognize them, somebody to wish them all. The terrible thing is to be unwanted. That this is the one area where because of the computerization and the revolution of the technology, the human touch, which is essential, which is mandatory, which is the healing touch, is missing from the people. We remember with gratitude the man, John McCarthy, who is the one who has initiated this concept of AI, on artificial intelligence, which is nothing but the computer which emphasize the creation of intelligent machine that work and react like a human being. So this is another term is augmented intelligence. We will come to that a little later. So these are the two wide views. One is on the Mother Teresa's statement on the human touch, which is essential, and the McCarthy's invention of the AI. How these two can combine, and that is what we are going to talk to you about the topic on the humanization of the medical profession and how it is important. This is not a new concept. When way back in I had a literature in 1977, there was a topic on the technology centralization and humanizing the healthcare. So in this today, we are almost 50 years after that, we are talking the same thing on that, the bringing the technology and the human touch together. So it is a relatively old. We know that technology has invaded in every life, every part of our life, whether even the people who are walking on the street with a cell phone always, whether they are in the hotel, whether they are lovemaking, they there. And it is almost like the technology has taken away the human touch, even the real hugging with each other. That also the concentration is going on the cell phone. That level we are there. And Albert Einstein said it has become appallingly obvious that our technology has exceeded our humanity. So the humanity is under threat, and we are trying to forget humanity. This is a words which has been spoken by Albert Einstein quite 100 years ago. But he says, and that is the era we are coming. We are forgetting about the human touch many times.
If you observe closely, मैं जब इनकी आंखों में रोशनी डालता हूं, पुतलियां सिकुड़ रही हैं, लेकिन सब्जेक्ट पलक तक नहीं झपकता। ए बॉस, ए हेलो, ए टॉर्च बंद करना। क्यों? अरे लाइट पड़ता है, तकलीफ होगी ना? अरे तकलीफ का सवाल ही पैदा नहीं होता। सब्जेक्ट कुछ भी महसूस नहीं कर सकता। सब्जेक्ट बोले तो नाम नहीं क्या? आनंद, आनंद बैनर्जी है इनका नाम।
This is just to show that we, whatever the new technology comes, the basic thing of ours is the human touch and the humanity. So why I chosen the word symphony? Symphony, we all know that it is the mixture of the so many of the music which is there. A combination of the music when they are writing, it is a long of music with quite a lot number of the musicians and with the various instruments they play. But there's one man in the center. He is the maestro, and who is going to coordinate the lot of people who are involving in that creation of the music and try to bring out one of the beautiful or the soothing music out of that. So similarly, in this era of what we're talking about, the artificial intelligence and the human touch, the surgeon is the master who is going to coordinate these two and bring this symphony. That is our aim, which cannot totally deny the none of this, and so that it needs somebody to make. So especially in the field of surgery, where the surgeon has to be a mastery of that. There was a great musician, and this man was one of the flutists, and he used to play the flute in a very soothing way. But unfortunately, he developed the tremor, which is a very intense tremor. Which if you have a tremor, you will not be able to do the music appropriately. So he underwent a surgery, and that is what we thought, that there are few areas in the brain which controls your movement in the hand. So it is a wake surgery, and the anesthesia was it is only the local anesthesia working on that. Patient is awake, so the people were doing some surgeries in the brain, stimulating particular part, and able to bring out and enable this man to play the music again. I just taken this because we are talking about symphony, where the technology can really improve the manage this man to bring a beautiful the music again. So artificial intelligence is considered now as an unavoidable evil. That is true because we know for sure, and we are going to discuss also the certain things of evil, but which cannot be thrown away just because most of the poets in the olden days says, if you see somebody evil, just get away from them. But now the era is not like that, and today the surgeon has to get along with this evil, understand this, and do much more things. And in this era of the AA, it's no longer a futurist dissonance, but it's a harmony which needs to be composed. Can an artificial intelligence be a powerful ally in our symphony under knife? Yes, indeed. And it is going to be one of the sophisticated and inevitable equipment field of science, which is enabling and the surgeons to mastery the art and various other parts. So it is important. There are a lot of articles has come in which talks about the artificial intelligence, a new tool in the hands of the surgeon, and mainly they say that normally a good surgeon has to have the intuition when he is doing to have the complicated surgery. May not be everything go 1+1 2 way, and something which is abnormal there, something which is rarely creeping in, and the surgeon has to have the intuition or gut feeling to operate on that. Must have the empathy for that. There must be a trust between the patient, and the privacy of the patient has to be. When all these are little endangered or it will be affected in the IAA, but it is the surgeon as a master of a symphony, and how he is going to bring in all this also into the field of AA is most important. So AI, artificial intelligence in the surgical practice, the heralds a new era where it talks about the three important words: the precision, the safety, and efficiency. So all these three are the hallmark, or when you are talking about the symphony of the AI and the human touch. So the errors which are happening normally in the surgeries, which needs to be avoided, and we need to be more precisely doing the surgical precision. We say the precision, the safety for the patient and the community and the patient, and efficiency which need to do. But all this depends upon the surgeon who's doing that. This is how you are organizing. There are a lot of things, and this is a lady. She is asking her colleagues, and three of them are there, asking them to support in pushing that vehicle which is there. and finally, if you see that she is asking them to do that, it's all depends upon the master and how you are doing that. So if I am saying that it is something which has to be done, and it has to be always done with the master, how he is utilized. It is irrespective of that. Both of the concept, just in human touch and just in AI, both of them may have a different opinion. But if there is a mind which is setting together to bring them together, definitely it will be possible to bring. There's a two handicapped people. They are physically disabled people, and see that one fellow is falling down, and another fellow, though he is still physically disabled, and they are able to come together and bring him back into that and bring a harmony. And this is exactly what we mean when we talk about the AI and the human touch, when you are going to talk about that. So this is little it has productive and counterproductive when you are bringing the AI into that. But we are not much worried on that, because the concept which says if the water is not coming from one end, and if you are making a try, at least the water will come from the other end. So the productive versus counterproductive of the AI versus human touch is always good. There are a lot of events which all of you know, because since there's a lot of common people are also watching, and I just wanted to screen this video. This is from the famous film by the Rajinikanth on the Indran, called that, where the robo which is trying to bring the delivery, conducting a delivery, which is one of the great arts to see that.
Plasma transfusion பண்ணலாம்.
blood pressure ஜாஸ்தியா இருக்கு. எந்த நேரத்துலயும் ஃபிக்ஸ் வரும்.
Maximum regimen கொடுக்கலாம்.
pelvic disproportion. normal delivery possible இல்ல.
Possible. Symphyostomy பண்ணலாம்.
So the artificial intelligence is depicted by Rajinikanth. He says that's a newer technology with which I will be able to deliver the baby. He takes up the position. The baby on the pregnancy, it is completely under the monitoring, under the control of the intelligence. He was able to screen the baby in the uterus, and just doing the pelvic disposition, a position where we are going to change the head of the baby. The head, normally when the baby is there, the head will be the presenting, but here in this baby, that's the gluteal region is there, and he is doing the internal version of that. And
doctor, Wi-Fi on பண்ணுங்க. Ultrasound video stream பண்ணுங்க.
So the other advantage with that, it is pre-putting. The mother is able to see that what is happening to her baby. The mother is visualizing that what is happening inside the uterus, and trying to see that how the baby is trying to come out. And it is always a combination. The technology and is been projected where exactly the people are. The entire world is taking with a great.
Artificial intelligence like ஒரு சாதனம்.
This is being depicted as one of the great success of the artificial intelligence, and understanding the deficiency, difficulties, and slowly the conversion is taking place. And though she is going for a shock,
இந்த 95 seconds அப்படியே முடிச்சிட்டு இருக்கு.
He is able to say that within the up to precision 42 seconds and 30 seconds the baby will be born.
4.44 பிறக்க போறோம்.
So
இன்னும் 55 seconds தான்.
So another 55 seconds, the computer is able to predict that baby is going to be born.
35 seconds தான்.
But though meanwhile she is going for a shock, she is almost collapsing, but still with the concept of the confidence which is given by the AI that this baby can be delivered, and it is happening. And so the baby is being delivered for that. So this is an on the plus point, that what is where we have the precision and how effectively. There are a lot of other things also having in the society and in the media. What we have a cockroach trying to grasp a human disease. That is, they talk about the AI as a cockroach, which is invading into that. And another article, especially in 2023 in Delhi, it has published that the superhuman algorithms could kill everyone in due time, that the researchers want. And AI could be used to take over the world through the evil fake news and hijacking cars. And these all are the negative impacts which has been projected by the artificial intelligence. But the answer lies not in rejecting the AI, its melody altogether, but in orchestrating its strength with irreparable human touch. And that is the dream with touch, and we are now working towards that. Is how best that we will be able to work. Both Association of Surgeons of India, Indian Medical Association, all of us are now cannot say that AI is bad. So we are trying to incorporate the artificial intelligence, but only thing trying to bring the human touch into that. And we know for sure the medicine is an art. It is not a pure science. And artificial intelligence and the human touch as the medical art has to be incorporated to bring the that. So it needs a
I have
smart
a
way of
challenge today for
working.
you. This
And
three glass is filled with Pepsi.
this
and
is
each
a
glass are
competition
empty.
which was
So the
put.
challenge
There are
here
6
is
glasses
you have
there,
to make it in a
and the
pattern where
competition.
you have one Pepsi glass, one empty glass, one Pepsi glass, one empty glass. You have 30 seconds time. In 30 seconds, you try and show me how you can do it.
Oh, that's very easy, sir.
No. But the challenge here is you can only lift one glass and make this in the order. So the time is up.
How do you do it?
It's very simple. You just take this glass and just put this Pepsi over here, and you have a pattern. One Pepsi, one empty. One Pepsi, one empty. One Pepsi, one empty.
This was so simple yet unbelievable, I think.
Absolutely. So the moral of the story: don't just work hard, work smarter also.
So this is a lesson, which is a teaching for us to also the surgeons also. It is not that what we are going to do with the hard work, but AI is going to help you in bringing it is a smart work, making the work very simple.
Anarika.
And what are the areas where the artificial intelligence can help a surgeon in making a consent for surgery? This is one of the very important area where how we are going to take the consent, the financial viability, and then predicting the values and input output cost, and how best you are going to organize that. They're taking intelligent decisions on augmenting the workforce, the precision medicine, personalized medicine, preventive medicine, and patient safety. In all this, the AI plays a major role. And this we all know now what is happening in a consent when we are taking the consent. Normally, people don't give much explanation. So suddenly a staff will come. She will ask somebody to put the signature on that consent form. She's pressurizing him to sign. He just asking, sir, what reason? And the staff is saying, no, everybody is putting, so you also put. So this is what now consent is taking place. Whenever you are going for a surgery, whenever you are planning for an operative procedure, it is mandatory. We need to get a consent. But because a lot of barriers, because maybe the doctor may not have the enough time to discuss with the patient may not be able to understand that thing, how he is going to give the consent for the surgery, what are the complications, what he can expect, what are the problems. But now AI is coming in a big way to help the bridge this gap, understanding of a particular disease. And if you go to the Asian Institute of Technology, I mean gastroenterology in Hyderabad, Nageshwar Reddy's hospital, there is one AI instrument called Mira. Any doubt you want, any questions you have in a surgery, any questions you want to have the consent. If you just go to that Mira is the robot which is there, put on a lot of in every floor. You can ask Mira, what I'm going to face and what is my problem. Then everything will be explained by Mira in a computer. This is pure artificial intelligence. There's no human being. But in artificial intelligence, all the data will be able to give. So this is exactly what we are now trying to see. The artificial intelligence will help the surgeons to take the big decisions when what to do with the consent and how to take a consent and what is. Many times people may not understand the language which you are seeing or the barrier of the language, English, Tamil, and the terms which are using. But the AI can give a lot of experience, lot of explanation, and can also show some of the videos to the area that these are the problems, these are the things. So this is one area where the artificial intelligence can help a lot for a surgeon in making the patient and relatives understand about the surgery, the surgical procedures which the surgeon is going to do, the complications or the expectations which can be very well be able to do that. And second most important job, as I told earlier, it is the financial performance and the burnout. And there's a lot of one of the problem which not a lot of doctors face is the too much of work, too much of pressure, too much of loan which they're taken for the rent they have to pay. The financial management is also becoming the turnover, the supply cost, the administrative expenses, all are mounting on the hospital. The insurance sector is giving a very low amount of fees, especially the Ayushman Bharat or the insurance voucher, whatever the charge they are providing for particular surgery, particular type of procedure is extremely low. And if that with that input, it would not be possible for a quality surgery to be done. How best we can optimize, minimize the expenditure, turnover, how to reduce, and how you are becoming AI can help us in a big way. And AI is a game changer in taking a decision and taking an intelligent decision. It is not that something which we are taking a generalized decision and like what many times the people say one particular drug, this can solve everything. A lot of systems of medicine used to say you take this breathing exercise, entire your problem will be solved. And take that's a generalized medicine that is not going to help what exactly a particular person needs and for his need. So that can help in a big way, and it can also predict and much earlier. For example, I just want to quote you that is a carcinoma of the breast. Today, when we are seeing a small nodule in the breast of 1 centimeter size, you know that how when the disease was started, actually it is something 5 years earlier, because from one tumor cells to become a two tumor cells, and two become a four, and four divides to become a eight. So it has to undergo 30 times the division, or 30 cycles it has to turn to come to become a 1 centimeter mass. Each cycle will last 3 months to 6 months. So remember putting that when you are feeling a 1 centimeter mass in the carcinoma breast, and that means the disease started 5 years earlier. So if I have a privilege and I have an opportunity to diagnose this at the right one cell when it is going abnormal, and how beautifully that we can prevent the disease, cancer, or cure the disease without much complication. Now there is one instrument has come. That's called ASIMRI. ASIMRI, like Mira in Asian Institute of Gastroenterology. ASIMRI is in the UK and US, and it is one of the system where and now we say that every woman to take a mammogram by the age of 30 to 40, and they should be able to continuously take a mammogram every year. So you feed the mammogram. The mammogram, we see a calcification, and it takes at least 30 cycles for us to make a decision. But the AI can help you to detect that cancer 5 years ahead of that what a clinician can be able to do that. And that is the most important picture. It is a revolutionizing the radiology field or the pathology field, and even taking a CT scan, they can predict and what kind of disease you are going to get after 2 years, after 3 years, because the bio changes which are happening in that body, which can be predicted by that. The Yesmiri is one of the big tool which is helping the surgeons to that. So taking an appropriate decision, the AI can help. We call it as an augmented decision making. This is all that you take a surgical decision, but the AI helps to take an augmented decision like in a breast cancer. There's a two terms. In the beginning, I said there is an artificial intelligence and augmented intelligence. Nowadays, the word AI, though most of the time it is interpreted as an artificial intelligence, but what we are now putting it as an augmented intelligence. What is the difference? When you say artificial intelligence, the machines replacing the human process. But augmented intelligence is the machines aiding the human process. Here it is not that only the machine is going to do, and that is always a lot of difficulty. But augmented intelligence is the surgeon, and for you to enable you are helping you to take. And in artificial intelligence, the machine takes a decision, but in an augmented intelligence, it is only the human being is taking the decision, that only the AI is helping in giving the suggestion. And it has been one of the most important things. So we are talking nowadays. I mean, most of the time that we are still in the augmented intelligence state, the complete automated, only one-sided, everything is done by the mission. Is not that what we are recommending. What we are recommending is an augmented intelligence, where we are having, there is a lot of theories which I not want to go there. So the augmented intelligence is a symphony of the artificial intelligence principles and the human touch, human intelligence and artificial intelligence joining together to take an augmented intelligence there. And one of the concepts which we talk about is a precision medicine. Precision medicine is something is into patient care, where it is exactly fitting into that. It's a patient-centered approach, or the in the treatment we are going to you may have a hernia. There are thousands of people who have a hernia, but the hernia, then there are different types of approach and how we are going to operate. But what fits to that particular individual, not generalizing everybody with hernia will undergo a mesh plasty, and that is not the statement which the augmented intelligence is going to decide. And augmented intelligence to go to take into consideration of the many of your the inputs, or the collagen or your things, and then they take a decision which is exactly fitting for you. It is a tailor-made to do, and artificial intelligence is helping in to take the personalized medicine. There are a lot of drugs now, genomics of the drugs. This is one of the concepts which is coming. And a lot of people who are there with the multiple diseases. But you have diabetes, you may have a cardiac disease, you have a hypertension, you have a liver problem. So for each and many times you take drugs, in multiple drugs we take. But that is necessary. So if you can study your genomic, and they were able to change the dosage and what kind of drug you are going to take, putting all this into a combination, and what the combination of the drug you are going to use. So everything is being decided. That is one of the most important thing on the genomic and medicine. If your cancer is there, and which gene is causing, and can we send some medicine, either a targeted medicine or an immunotherapy or a gene therapy, so that alter that gene. So exactly to targeting to the particular individual is able to done by the AI, which helps us with the predictive analysis. They can not only diagnose, you can predict your prognosis, whether your response to chemotherapy, whether this drug is going to act in this person, and what kind of recurrence if after the surgery, and how many times, what is the possibility of this person going to develop a recurrence, and that can be done. And even you can monitor the patient in a remote area, and understanding the adverse and impact which is going to be created. So all these are possible with that, with the decision taking of medicine. And most importantly, it is the AI helps in the patient surgeon to make a patient safety, and your identification of the patient, and the quality of the care which you are giving, the concern with which you are going to get the consent for that, and all that will be enabled the patient safety. One of the most important thing is the errors in surgery, which is happening. One of the commonest is operating on a wrong side. It's one of the famous film which shows that they taken the patient to America for a brain surgery. It has to be operated on the right side, but there in the surgery it has been done on the left side. Now, this is not an one or two incidents. There are many incidents as coming, operating on a wrong patient, operating on a wrong side, operating on a wrong procedure, and these are the common things. But these can be very well avoided by the artificial intelligence, which can predict the patient and what we can do. This is the one the artificial intelligence has created in black box. We know that whenever the flight or any airplane get into an accident, they get into after that they take a black box from the mission, which will be exactly taking the picture of what is happening at that moment, and they will be able to come to a conclusion and what is the cause for the disaster which has taken place. So similarly, then now artificial intelligence has created a black box concept which will enable and help to avoid all these avoidable mistakes which happening, wrong surgery, wrong time, keeping the foreign body in the body, keeping the scissors or that instead. So this is one area. It is something sometimes it happens beyond the human intelligence, beyond the human, but the tiring surgery, the surgeon may not be able to look for all the whether there's a foreign body is there or not, and sometimes the mistaken identity is there. So this black box concept of the artificial intelligence will help in that to help the surgeon to take a decision based on the algorithm and the common solving the common problem. So coming to the augmented intelligence, artificial intelligence, and there are three layers of that, and this is what that everybody should know. We are not just talking about a superficial term, artificial intelligence, but it includes three important concepts. One is an artificial intelligence, second is the machine learning, the third is a deep learning. So now we are going towards the deep learning, and the response to deep learning concept is going to come. What is the difference? In artificial intelligence, the ability of the machine to imitate is intelligent human behavior. But machine learning is the machine itself is going to learn. You are feeding something like what we know when we are born, and we may not know many things, and we study from the LKG to the being a doctor. On the process of this, we learn everything, and we engulf, and we take decisions based on the input which we are going to take. So same thing is happening in the artificial intelligence concept in the computer. The data which you are going to give, and with the data itself, then it will learn. The computer itself will learn, and it is going to react to that. And still more learning is a deep learning. It is not only that like whatever you hear from others, we will not immediately replicate that, and it goes to our brain, and the brain synthesizes it and assimilate that, find out whether it is a truth, and then it produces a response to that. So it's the input, there is a processing, and that is exactly what is happening in the deep learning. The machine itself start learning. In a machine learning, you have a data, based on the data it is going to work on that, output is going to be there. But deep learning is something more. It is exactly like a brain, where there is neurons are there, hidden neurons are there, and they give a response. But so far we couldn't have just only a response. There was no emotional response, emotion. But now the fourth generation artificial intelligence is coming. They can also include the emotion or empathy into that set. So your response is going to be based on that. That is the deep learning we are going to have. There are a few examples for the deep learning, and the machines learning itself and bringing is one of the computer vision. Now we are looking at a particular part, and we are only seeing that there is a thermostasis is there, and whether it is going to for a leak or not. And particular area, if you are going to subject it to the computer analysis, computer vision, which is based on the deep learning principle, and you are going to be and exactly get a lot of that. And also there is it helps in the surgeons to take a decision. There are a lot of platforms are now coming. One of the most important is three-dimensional virtual reconstruction. Iris 10 system, which has been the intuitive system of the surgical, where the robotic surgery is going to take place, and the Farmers platform. These three are the very common platforms where the deep learning principles of the artificial intelligence is helping the surgeons to take a valid views on that. See now, you take a picture, CT, and kidney is there. There is a small tumor which we are seeing in the CT. But by artificial intelligence, it can recreate the entire thing like a 3D picture, where you can see the width, depth, and the depth, and the surgeon can precisely, before going for a surgery itself, and plan the action, what is there, what is anterior to that, what is posterior to that. Very exactly, he will be well prepared, and if there is any special instrument has to be kept for that surgery. So this is one area, the three-dimensional virtual reconstruction, helping the surgeons to plan. The intuitive system, this is mainly for the robotic surgery. The formula platform, this is helping in the orthopedic surgery, and exactly they can do the scalable and personalized data-driven orthopedic care is being done by this. So, and when we are doing a surgery, something like that, when we are doing a surgery for a uterus, or when we are doing a surgery in the pelvic region, one of the most important structures which we need to be very careful is an uterine artery and uterine ureter, and the few important nerves, especially when you are going to do the laparoscopy surgery. And this artificial vision, when we are going to bring in the 3D concept of the artificial intelligence, that can exactly will be able to sell you. So here is the nerve, and what you are seeing is an artery. What you are seeing is the vein, and that kind of precision now the artificial intelligence is able to do. And this is another important area of automated case retrieval based on AI. There is a lot of people might have done. You are coming across one of the rarest surgeries, and may not be the literature is giving that, but the artificial intelligence, the global data, the automated case retrieval based AI will help you in anywhere, in the whole of the globe. If there is any one case is being reported, and that will give you a data so that you will be able to do the decisions for that. There's a lot of in the cataract surgery it can do. That is one of the most important. This the artificial intelligence can normally, when we have a tissue, we take the tissue and send for the biopsy, and the biopsy only it will be coming as and what kind of cancer. But now the endoscope or the machine itself can penetrate into the cell, and cell is quite a very small structure, and the confocal laser entered into the cell and able to find out and give the surgeon, and this is the area there is a culprit is there, this is the area which is a problematic area, so you go and take a biopsy from there, and the yield is going to be good. So confocal. Another most important thing in the OCT, especially in the retina, when we are doing the ophthalmology, is optical coherent tomography, and like a ultrasonography where we are using the sound wave, here it is the optical waves are used. So enhanced precision, improved safety, personalized surgical plan, and continuous learning all are possible with AI. And one of the most important problem in the laparoscopy surgery today, and when we are seeing the magnified vision, but we will not be able to see the touch, feel of touch, where the patient, whether I am touching a vessel, I am touching an artery, and that touch feeling will not be there, whether it is a fibrosed organ or normal. So now artificial intelligence is bringing a role of haptic feedback, and as soon as your instrument touch something, it is connected to the computer artificial intelligence. It will gives your brain, no, you are touching a body, a solid organ, or you are touching a cell. So that is a haptic feedback. There's a new concept as some say e-skin, and this is one of the important thing to help in the haptic feedback, especially in a patient who have a temperature plate. You are doing a cautery, you are putting a cautery, and how his temperature is there in the skin. The surgeon may not be able to see that if there is something wrong is happening. So immediately it will give a haptic feedback, and where we are able to see that. So training for the surgeon, another important area where artificial intelligence is going to help is getting the dexterity, and the training for the surgeons are also important. We used one of the very important word called democratizing surgical expertise. So somebody, a surgeon who is there in AIMS, All India Institute of Medical Science in Delhi, and somebody who is there in a low college, or in the rural village where the college, like what the college I am working right now is a Kanyakumari Government Medical College. There is optional the difference in the number of workloads, number of missions he is having, number of experience they are going to have, number of good surgeons which they are having is tremendous. Where in the rural areas, it may not be have that sophisticated equipment. But this artificial intelligence is going to bring a democratization where everyone, irrespective of their where they are studying, can have a kind of enhanced training through this the VR artificial intelligence, or the visual reality intelligence, or the simulator which is coming with an artificial. So I can go to the simulator and get trained as a person who is there in AIMS or in Soviet equipment. So this is one term which is now being used, is a democratizing the surgical principle. That is very important in the surgical training, what we are going to that. Artificial intelligence can be also be there to give the emotional support to the patient. And many times the surgeons may not be able to talk with the patients and get like that, what I told in the AS, the Mira in Hyderabad, and every hospital slowly they are going to bring the robotics and the people to support this evolution there. Another area is the barrier. Artificial intelligence break the language barrier. I can operate on a patient on a Kenya or Korea, because my artificial intelligence machine will translate the language and communicate and help us. So it helps the surgeons to transcend the barriers, and understanding this and bringing this together is very important. Yes, artificial intelligence has a pitfalls, because what we are fearing, one of the fear we have, if everything like this enhanced being the computer is going to do, the dexterity and the skill of the surgeon may come down unless you are routinely doing that procedure, and you will not be able to get the expertise. So there is a lot of challenges. Yes, it is true, but it has to be the has to be bring together this human touch and the artificial intelligence. One of the big danger as a social medical activist, what we feel, this artificial intelligence has brought a broad, false sense of knowledge in the people who are not studied the medicine, the science of medicine. We are getting a lot of reports. There is a woman or a husband trying to make a delivery by seeing a YouTube, say seeing the artificial intelligence input, and resulting in a very dangerous disorders. And this should be totally avoided. It is only a combination. You must be in a medical science with a human touch and the augmented intelligence. It is an augmentation of your intelligence. And those who have you have when you have a zero of the knowledge on the medical science, and whatever the augmentation is going to be there, it is going to be only a zero. So this is one of the social evil which is happening with that, and that we need to another challenge in country like India is the as I told earlier, the machine learns from what we are putting an input. It is a data is the one which is going to decide the output for the output. Now today in the world, in the globe, the data is the currency. It is not the dollar. It is not that. And when you have a lot of data, then you are the big rich man. So, but what is the standard of data? If you are going to put rubbish or the rubbish or the waste into the computer, you are going to get only the waste out of it. Unfortunately, in India, what we are seeing, lot of wrong data are published in the newspapers, in the journals and index article. And if you see in the last of few 2017, 19, 20, we have almost quite a number of journals where articles were taken back because there's a lot of mistakes, plagiarism, calculation, data sensitivity. So this is one that is over 3,244 papers, data were found to be fake or wrong data. But computer cannot detect that. Computer is going to learn this data and put that. If you see that appendectomy produce 10 only if you do a cut the appendix and somebody put on paper saying that I have cut in the middle of the appendix and the complication rate are only 0.5%, and that is what the computer learn, and tomorrow they can also give. But factually that may be a wrong statement which is made for just for the sake of application. So this is one area where we need to be extremely conscious. Then the trust we can give our body. It is some surgery is what that we are giving a body to somebody to operate on us, and that somebody must have the character, a smile, a touch, a hand touch. So that is lacking totally in an artificial intelligence. So that what we are saying, we need to have an augmented intelligence where we are going to have major things together. And one of the article in Albert Einstein's in the like that, the true sign of intelligence is not knowledge but imagination. This is again but said by Albert Einstein. So we are imagining that is in the world of coming. Augmented intelligence will help us to do exactly the safe, precise, and the medicine care. Probably we may surgeons may only act like a pilot in the flight, taking off and landing. The role of pilot is very important. In between, in their missions will be able to do the things, but we cannot deny the role of surgeons. Automated intelligence is a different thing, where everything done by the computer. And this is one example we commonly show. There's a war is taking place, and then one of the soldier is shot. So a carrier is coming, lifting him immediately and going to another vehicle where you have all the facilities for machines doing the scanning. They are scanning it. They find there is a bullet inside that femur, tibia, and the machine itself is able to do everything by doing a surgery, able to take out the bullet from that area. So that has been healed, sutured, put it. Again, he is taken in the vehicle, dropped in the field. So this is imagination, but what we see, there is a AI, augmented intelligence will enhance the human capabilities, and when these two are joining hands with together, and definitely there is a possibility that we will be able to bring a lot of change to the society in the way which you are doing. So though in the I want to repeat the statement which I made in the first slide, that artificial intelligence is an unavoidable evil, but it is on the hand of the maestro of the symphony, the surgeon, how he is able to bring the human touch and utilize the benefits of the touch. For ultimately our aim, the patient should be safety, the patient should have a good opportunity to get a good quill. So definitely it is a boon, it is going to help, it is going to change the concept, but we are looking forward to have a positive impact with this combination of this. We believe it shall be a good symphony where the artificial intelligence and human touch are joining hands with each other. Thank you very much for the opportunity. I'll be happy to answer to of your 4 questions there.
Right, sir. Thank you, sir. Thank you so
I
much
will
for giving
stop
us
sharing. Okay.
this very valuable presentation. Yes, yes, sir. Sir, now moving on to the questions. So the first question is, AI has the potential to tailor surgical approaches based on patient-specific data. So how far are we from achieving true personalized surgery, and what challenges remain implementing, such as AI-driven precision medicine in the operating room?
Yeah, now it has been very well being utilized. One of the robotic surgery is one exactly doing the same thing. If you see that it's a few years back, we had only 1 or 2 robots in the whole of the country. Now we have 170 robots, and 12 new companies are bringing in robot to the extent that another 5 years, and most of our operation rooms will have the robotics, where it is exactly the precision medicine. That is the data that come into the computer. The surgeon is only operating on the computer, and with the magnification, with the dexterity is being preserved. That is one of the exact, and also the datas. And when you are having there is one surgery called Google surgery. So all the inputs of the patient can be put on to that, and that will give an exact solution for how you are going to do a lot of procedures in that computer navigation surgery, computer assisted orthopedic surgeries which are happening on that precise localization of the tumor cells and going to that called stereotactic surgery. So this almost now it has penetrated 25 to 30% of the surgical. Artificial intelligence is helping us in a more big way. As the days are going by, as the science is advancing, I'm sure it is almost we will be the augmented intelligence will take over or aid the surgeon in a better way. So this is happening. This is going to continue to happen in the society.
Right, so there is one more query, that is, what are the key ethical and medical legal concerns that arise with AI assisted surgeries, and how they can be like addressed in case of ensuring patient safety?
Yeah, this is a very good question which has been asked. One of the problem with the AI is ethical. So this was something like similar to that incident. Suppose the AI driven car, somebody with the artificial intelligence like Tesla car, I mean AI driven car, and you are driving, and there is a two people are coming in front, and one is a small girl, and one is a old lady. Anyhow, this car has to hit. If there is a driver, he can take a decision, conscious decision of that what is going to happen. But how the AI is going to take a decision, nobody knows. And even if the car is hitting, and to whom you are going to find the responsibility, there is a big ethical dilemma. The same thing is there, but it is a proven fact in medical field the decision belongs to surgeon, or the surgeon is the master. It is not the one. The AI cannot be. Though the AI is going to give wrong data, wrong output based on the inputs which have. The ultimate way who is going to take a decision is only a surgeon. That is why when you see the lot of reports in the ultrasonography reports, it will be written. It is only imagination. The decision has to be taken by the treating doctor. So the mammographic AI can tell you this patient may have the potential of the carcinoma, but the final decision has to be taken by the surgeon. So one of the big principle of ethical is this AI is not responsible for taking decision, and surgeon has to take the diagnosis. And treatment, what kind of treatment you are going to give, again, it is not the AI is going to take the decision. It is an autonomy of the patient, because many times this autonomy, that is one of the most important word which we are going to talk about, is the choice of the patient is most vital. So all the data can be given to the patient. Is like a cafeteria approach, where when you are going for a coffee or tea, they gives a big calendar and a lot of what are things available, and it is you have to choose. So that cafeteria approach is the best way ethical. The third ethical problem which we are facing is the justice, because whether you can say that the same everybody will be able to get the same kind of the high turnover of the high power utilization of the AI. Definitely not. India is yet to come in a big way to do that, and that is another challenge which we do. Finally, we'll say that one of the most important concept of the ethics is the maleficence. That is the primum non nocere. Whatever you do, never do harm to the patient. Though there are a lot of in the interest of the artificial intelligence, people have started doing a lot of mischievous things. Very recently, from USA, one article has been published that for doing a thyroid surgery, he has put a colonoscope through the anal canal, reach the stomach, and from there reach they made an opening, reach to the neck, and did the surgery of thyroid through the anal canal. Thyroid surgery is done. It took 24 hours. It patient had to have a lot of problems, or a lot of issues were reported. Is it a success? Is it a maleficence? Is it a prime non-nocere? Absolutely no. So that the technology, it is a feasibility. So when you say the feasible, and the feasibility may not bring the goodness to the patient. One of the most important concept of the ethics, whatever I do, it shall be for the beneficent, and it shall never do harm, beneficence and maleficence. So that is one of the very, very narrow line. That is, it is ethics is a dynamic one. Ethics cannot predict exactly what is right and wrong. So that is one narrow line where we need to go forward. That is why we insist the human touch, the human approach, the humanity, the human value has to come in. If appropriate humanity is joining with the AI, this ethical concept can be definitely can be overcome.
Right, sir. Thank you, sir. Thank you so much for answering these queries. And thank you so much for giving your effort for making such a beautiful presentation, sir. Thank you. Thank you so much. And yes, thanks to all the audience for joining in, for putting up the engaging questions. So, with that, sir, I would like to conclude the session for today. Have a good day ahead, sir. Thank you.
Thank you. Thank you.
Thank you, sir. Thank you so much. We are honored, really honored, sir. Thank you.